Hey, everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his book, America on Steroids, It's Time to Heal, available at Amazon.com. And please check out his website, Testosteronology. This is a new branch of men's medicine pioneered by Dr. O'Connor. What is it? Go to Testosteronology. You can see it right behind him there. Testosterone, drop the E, and then OLOGY, and you're good to go. Doctor, how are you, sir?
I'm in the studio here, Ron. It's just been full bore, insane, digital, telemedicine. It's just been, I thought it was going to be maybe slow or just
Yeah.
whatever. It turned around to be more. It's just crazy.
Let's put this in perspective. When you're in your office in either Connecticut or Florida, how many patients will you typically see in a day?
Well, I don't, because I'm a retainer-based doc, I only see max is like 10, but I only see probably like 3 or 4. Everything is always, I've always been telemedicine,
Mm,
calling people back, reviewing labs, answering questions.
yeah.
So, but now everything is completely tele. We have a new office. We moved down to Essex, Connecticut.
Oh,
You know,
okay.
we just go from the house to the office. We don't see anyone. I don't go to the hospital. I stopped doing that probably 5 years ago. So
Right.
for better and worse, I just don't have that credentialing anymore. So, but all the doctors and nurses and healthcare workers out there that are in harm's way, you can just say, God bless them. It's unbelievable.
Yeah.
Police, firemen, everyone, nurses that work in nursing homes, nurse techs, PAs, physician's assistants, nurse practitioners, all the nurse assistant people that are out there taking care of elderly people in nursing homes.
Mm,
This is,
mm.
nursing homes is like they're like mini New Yorks.
Yeah. I mean, there was that one nursing home in Washington State where, what was it, like 47 people or something? 50
Just
people in one nursing home died.
so it's
Yeah.
just and they're it's unfortunately it's a small, they're together, and it's obviously does spread, even from probably just very close, just breathing, respiratory, just in people's just inherent talking, that you're launching. Some people talk, and
Say
and
it. All those people that you have to say it, don't spray it. Those are the people you got to keep clear of these days, dude.
but even just talking, you're just your respiratory droplets are even just, if this is true, if it's really that contagious, which it might actually be, this is why it's so bad.
If it's that contagious, and I know you're not an epidemiologist or anything, but if it's that contagious, isn't everyone eventually going to get it at some point? Maybe they'll have no symptoms, but everyone will catch this.
So that's the point. And in my, we're holding off on the anabolic steroid talk for right now. We'll get to that in a minute. But I mean, if you look at it, so what we're trying to do, and if you look at the news just tonight, they're talking about they're getting immunologic, they're trying to look at your antibody testing to see if you've had it, I've had it, I might have actually had it, my family. So we need to see in a map who's had it, who hasn't, and you're gonna wear a bracelet, literally, that says that you're immune to it. You're not spreading it, literally, because you've had it and you've convalesced. So therefore, not to mention, they're doing some studies. I think it was in Texas where very sick people in the ICU, they're gathering serum. They're really IVIGs. They're immunoglobulins from someone who's recovered,
Mm.
and then they concentrate it and they give it to someone because it's really it's like, they're antibodies, they're your protection, so they can sequester and they can help take out the active viral particles that someone has. So we need to see that we've had it, and then they're going to look at the map and they're going to be able to see in what communities, districts in the world that these people have already had it and they're convalesced and they can move forward. This is so important. But the government, it's America. We're doing great. I mean, we're not, I mean, it's not doing great. Let's
Mm.
be honest. We're doing the best we can. The government is trying. I think, both the Democrat and the Republicans, it's just terrible. If there's on any end, if there's any name calling, shut it down. We're
Yeah.
doing the best we can. This is like people, we're going to be into, we're going to be in a recession.
Yeah. Even
I
your poodle is upset about the bipartisanship. I can hear it
Listen,
going
I
crazy.
mean, I'm just working around the clock. I have to work in another 20 minutes and just take some food in. This is my
Yeah.
mountain bike outfit. I'm mountain biking when I can just to stay fit.
Yeah.
Anyway, Ron, so that's
Okay. Well, let's get to the topic. Yeah, you're. I think every doctor right now in every capacity is overloaded. I think just the whole medical field right now. Everybody working in the medical field is working double shifts and putting in. God bless them all, guys. Appreciate everything you guys do out there, all you medical professionals. So you did a video. I think it was almost 2 weeks ago now, called "Quarantined on Steroids." And so we're all quarantined now in this US of A. I think there's a few states that are holdouts, but most of us are quarantined. And a lot of the viewers of your videos and this particular videos on MD, Anabolic Doc is his channel, steroid users, either on TRT, on steroids, and potential medical issues that will come with that. And the whole purpose of your video was you want to make sure these people can stay away from hospitals because you do not want to go to a hospital right now. Every hospital, every single hospital, when you walk into emergency room, there's got to be coronavirus patients in there. They've touched things, they're breathing, they're talking. I'd be scared out of my mind to be in an emergency room right now.
yeah, potentially, yeah. I mean, some places are better than others, right? But New
Mm-hmm.
York, I mean, bad news. It's tough, tough. You don't want to go to the. It's not time to go to the hospital with even just a skin infection that's not going away with Keflex.
Yeah.
You
But I
know,
mean, this telemedicine is normally they would need to prescribe you something. Typically, wouldn't you have to see is this getting around that old thing where the doctor
so
had to physically examine a patient?
before this, that's why I have a practice in Connecticut and Florida, and before I would prescribe, I have to see every patient, conduct a legitimate inpatient, in-person, doctor to patient history and physical,
Yeah.
and everyone comes to Florida mainly or Connecticut, and I line them up, and then when they go back, and then you see them and you do labs in 2 months or 4 months. It's like, hey Frank, how you doing? Hey Doc, what's going on? So, you're on testosterone now. We're watching you. You went to last week, you went to get your CBC done. Now, meanwhile, I saw him 4 months ago.
Yeah.
So he's a patient.
Right.
And then every year, and there's no direct laws on this, and this is why it's evolving quickly. So before this, telemedicine is state per state. And if you're licensed in Connecticut or if you're licensed in Florida, you could actually before this crisis, you could legitimately, if you have the proper platform, which I do, which is a Zoom, not this. You can't technically do FaceTime. You can't do Skype. It's Zoom, and
Oh.
there are other ones. I use Zoom, and
Yeah.
it's end-to-end encrypted, so no one can break in.
Oh.
It's for confidentiality, and
Right.
it can't be taped. I can't tape it. It's actually very interesting. It's what you
Huh.
think that if you're doing. We have a medical record I have everything. It's all online. I've been online and digital for, since the beginning, and
Right.
now it's completely digital. During this time period, they've the president said it himself 2 or 3 weeks ago. There's no more. Doctors need to keep people out of the clinics and hospitals. If you're a doctor and you want to call and talk to a patient, common sense, talk to the patient. If they are coughing and they have an upper respiratory infection, looks like a sinusitis. If you think it's appropriate to give an antibiotic, you don't need to see that patient. Ask if, do you have allergies? What are your medical history? I mean, if you really work with people I'm a doctor, medical doctor. I'm not a surgical doctor. I don't do surgery.
Yeah.
So plastic surgeons obviously are on the sidelines. General surgeons are busy taking care of people that are in trauma, that are taking care. I mean, this is not time for elective procedures, right? This is emergency. And some hospitals that are not overloaded. In New York City, Lenox Hill Hospital, you're not going for plastic surgery right now. I mean, that's not. So they're trying to keep doctors like me that are internal medicine doctors, and I do have some primary care patients left, not too many, but they've already called, and I'm keeping them. I very carefully, no new medicines. You know, if you're coughing, I still have a few people that are over the age of 65 and 70, and I'm on top of them like white on rice. I mean, if they are having even a cough where maybe they're productive, and I worry that I don't like using antibiotics. I'm doing it earlier than I normally would. I'm trying to really I talked to a man last night who's 70. who we made a decision. He's got chest pain. Is it respiratory, or is it asthma, respiratory versus coronary artery? Like, is he having angina? We spent 20 minutes on the phone to about 7 at night. I'm really because do I send this man to the ER? I think we did a good thing because he didn't call me today, so obviously I think he's okay. But I said in the middle of the night, if your chest pain, it was atypical chest pain. Doctors that are experienced like me and other healthcare providers, we're just on edge. We're trying to get the crystal ball. We're trying to keep you out of the hospital. If you go, imagine you go into the hospital, and no one ever wants to go in the hospital, Ron. But if you're doing, I know we're going to talk about it, but it's not the time to do a new cycle of Tren or Equipoise. I'm not being a wise guy. If you do and you're short of breath and you have a bad reaction, you look at the video, look at the comments, and people are overloading our phone lines because they're concerned. I think they're also home and they're stir crazy.
Yes.
And people are, guys, they can't get steroids and testosterone, so a lot of guys are going into withdrawal.
Oh, dude, jeez.
Ron,
No bueno.
I don't know what to say, so I don't want to take your questions away from you.
No, that's okay. I mean, this isn't really a question, but I mean, I've had, because people come to me for steroid advice, and I tell them up front, I'm not qualified, but, they'll just say, well, what do you think I should do? I said, I can tell you this, I would be on minimal stuff right now, minimal. Because I had somebody I was helping get ready for a show. He's like, should I stay on? And he was a good amount. He was 8 weeks out. Pre-contest cycles are substantial, as you know. He said, what do I do? I said, go 250, sip a week. That's it. Cut it down. He says, what about the this and that drug? I said, nope, nothing else. Just, this is not the time.
It's time to cruise. I said in my video, guys, not time to blast. It's time to cruise.
Yeah. Don't go on a cruise ship right now.
Oh my God. Cruise ships.
Are they still, I think they're still selling cruise packages too.
It seems like every cruise ship, there's another one out there that they're just driving around with sick people and dead people. Who is ever going to go on a cruise ever again? I'm not.
There's one Alaska cruise line, something. Uh-oh, you coughed. But 60% of the people on board are positive for coronavirus.
That's the one I saw, Ron.
Yeah, and they're like, nobody wants them to dock at their city. Look, get away from us.
Exactly.
Take your coronavirus somewhere else.
So bad.
So your video, let's get back to it. Your video was called Quarantine on Steroids because we have, I don't know have you ever tried to get a rough figure? What do you think, if you could estimate how many men are on either TRT or steroids at any given moment in the U.S., country of 330 million people? If we say half of those are men, so there's 100.
Steroid using the estimation.
TRT, throw TRT in there too.
Oh, 25 million, 100 million. Okay. Yeah, so 100 million. Yeah.
There's a lot of guys. That's a huge amount of our population.
Yeah, tens and tens of millions.
Okay, so all these guys, even if they're just on TRT, there are medical complications that you're at a higher risk for that you want to watch. You don't want a heart attack. You don't want a stroke. You don't want DVT, pulmonary embolism. And this is important because a lot of guys now are less active. They were more active before, and now they're just laying around like lumps, and they're still on these steroids. What are the increased dangers somebody might be facing on steroids now, just because of the whole situation we're in with the quarantine and not being able to go anywhere or do much of anything?
About that. So if you're on anabolic steroids, the basic risks will always apply. It depends if you're new on it, if it's Murphy's Law, and I never been on steroids for years, and then I had why did I have a heart attack after 5 years or 10 years? Or let's talk about a DVT. So if you have a clot in the leg, right, and why does it happen? The moons line up. It doesn't happen with the first week on steroids. It doesn't happen to, thank God, a lot of people on steroids. It never happens. Yeah. But there are men, even on TRT, they have a past medical history that they have genes for a hypercoagulable state. It's factor 5 on Lin. There's a couple of 2 or 3 classic genetic. And then if you have like, hey, yeah, my dad had DVTs, pulmonary, hypercoagulable. So this is genetic. Then they're on steroids. They're home and they're not moving. So, when you get that clot, God forbid, it's because you're on a plane. You're obviously, you're not moving. You're immobilized. Maybe you have a calf boot on, you ruptured it. This is the classic stuff. You had some surgery of your Achilles tendon rupture, and they boot you up, and then you're not moving, and then all of a sudden your calf swells up, and you go when you talk to an orthopedic surgeon or any medical doctor, and you got a calf boot. The calf boots, the orthopedic,
of course,
they've stabilized you, and you're hobbling around, and you take it off, and you go, hey, honey, why? My leg is like, my ankles are swollen and my calf is blowing up. That's ER time. And that's a DVT until proven otherwise. That's a clot. And then if you don't catch it properly, I mean, you could see that if you have other medical issues and it's bad timing, you can lose your leg. They can cut that
happened to Flex Wheeler.
That's Flex had a DVT, and it was a DVT for a very long time. They tried very, 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 very hard to open it up. Vascular surgeons, they tried and tried, and he lost the fight, and they said, you're either going to die from gangrene or you're going to have to let the leg go. So that's super, 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 super rare, but the clot can go from the calf area up to the pulmonary in your lungs. I'm so tired. I'm so sorry.
Yeah, it's okay. I'm sorry.
Goes up to the lung, and you have a pulmonary embolism, and then you can die. I've had hundreds of men on testosterone and steroids have DVTs and pulmonary embolisms. It happens, guys. It's a risk of being on hormones. It happens to women on estrogen, and it can happen to men on testosterone and or steroids. So imagine Murphy's Law, bad luck, you're home, you're doing it on steroids, your cycle, and you're not moving much. So you're sitting around a lot. You're immobile. You're immobilized. Boom, wounds line up, calf starts to swell. You got pain in the calf. You're 911 now. You're in the ER. You got a blood clot in your goddamn leg. You got to be admitted to the hospital, man.
Mm-hmm.
I see it, but hold on. I see it. Well, I do. I mean, I get the worst cases coming to me on top of guys that are smart and they come in too early. Doc, take me away. I'm on steroids for years. Can you help me and evaluate me? Can you please work with me, Doc, and see if you could stabilize my testosterone so I feel good? And this is my business. I'm not saying I'm overloaded, but of course I've created this thing myself. And again, anti-aging medicine, they have to either go to jail, or they have to be shut down, and people are leaving them in droves and coming to me and God knows where else. And again, guys, I'm not a politically correct guy. They're killing people with all their ridiculous anti-estrogens, Clomid, HCG. I'm not saying these aren't drugs. Again, Ron, you see how I am now? Imagine my attitude now, Ron. Now I'm overloaded, and I'm just getting crushed with so much guys coming in business and people calling that. I just see anti-aging. I'm taking in guys from every state from anti-aging. The wife is in the background on the side today from Texas in tears. What the drugs that these anti-aging doctors anti-aging, and my husband had a heart attack. Has a stent put. Attack. How is that going to be anti-aging? I don't understand it.
It's anti-living. Man, where were we, Doc? So
I'm so irritated.
I know. It's okay.
You want to do steroids, guys? You're going to fucking pay for it potentially. Good luck.
So what precautions can steroid users or people on TRT be taking right now to make sure they don't have anything happen to them that would require a visit to the hospital?
Well,
if they can be proactive.
Let's be honest about it. If you're on steroids long enough, and you're going to have to make the decision for yourself, guys. If you're on steroids long enough, what's long enough? If you're on your second injection, stop it immediately. If you're 18 years old or 26 or 38, and you've done 2 injections, stop it. You're not going to withdraw. But if you're on steroids for 5 years or 3 years or 2 years or 10 years, okay. So if you're a chronic steroid user, I love you guys. Okay. Don't stop, take TRT doses like Ron's saying, and it's not time. I'm training with a buddy of mine in an isolated gym. I don't want to say he has no friends. we're isolate. We're like social distancing training like once a week on a mountain. This is my mountain bike outfit. So it's very, yeah. So but the truth, what I'm trying to say is, I want to bench more too because my pec is feeling great. I'm going to bench 405 again,
Yeah.
and I'll do it with a little bench daddy thing on, or this whatever that the little thing, not a shirt. And I'm thinking, is it my day to go up? Hey, to my buddy Rob. Hey Rob, is today the day that I put 4 plates in the bar? Probably not. I mean, like he's a good spotter. I'm not going to die, but do I tear the pec off the bone today again, or So it's like, and I know, guy, this is now. This is I'm not putting guys down for this. I'm saying even me. I'm mountain biking. I just climbed up mountains and with a poodle, and it's like I'm trying to go easy, trying to blow off some steam. But I mean, is it the time to train and get a new personal record, Ron?
It's not even the time. I'm telling you right now as a friend, Tom, I don't want you mountain biking anymore. Too dangerous.
I mean, I swear. I mean, I can't take. So, but it's, for back to the drugs.
Yeah.
Like, so this, I'm going to ask you a question. This has never happened ever in the history of time, right? Since 1918, whatever. We have
World War II, when they, as far as people being quarantined.
But
oh,
no, you're right. But I mean, since steroids in the 1990s and the mass monsters. So all these guys, what are they doing, Ron? What are these how are they going to compete? Probably we're going to be quarantined. We're not we're not peeking our heads out until, don't get mad at me for this, April has to go. April, we have to go to the end of April. May, they have to cool through May. We're going to peek our heads out in May. They're going to open up districts in May. This is my prediction.
Yeah.
Everyone has to work that are essential, and who's not essential? Truck drivers, anyone, post office people, bankers. I mean, who's not essential? Even haircut people. I mean, look
yeah. You need a haircut, dude.
So it's like, okay, so we're going to get back out there, but when do bodybuilders start ramping up their steroids again? And then when do the shows start?
Oh, you want me to try to answer that for you? Okay, well, so they're going to make an announcement on May 10th, the IFBB and NPC, as to what their plan is. So far, they've already had a couple shows have been completely canceled. Others have been postponed. Like New York Pro was supposed to be May 12th to 13th. They pushed that to August 8th, which hopefully is enough time. But like you said, the gyms are all closed right now. I know there are pros that are still training. They have keys to gyms or whatever the case may be, but a lot of them are not training. So how can you just go from these people have been at home with some dumbbells and bands and a paper clip and an eraser, and now you're going to say the show's in 4 weeks. You guys need to get ready.
Let me ask you a question. Are the no names mentioned? Are these big monster pros? What kind of steroid program are they on right now?
I mean, when I've talked to these guys, it's just about, are you still training? You're still getting ready for a show. And a lot of them are, if they were preparing for a show that was supposed to happen during this, what's definitely going to be a full quarantine period. We're not getting out of this till May. It's pretty clear now. They sort of in a holding pattern. They've cut the doses down. So the plan is to kind of keep their body fat down, stay lean. And I'm encouraging everyone to do the same thing. Stay lean, guys. Eat clean, do your cardio, because you're going to probably lose a little mass, because you should not be doing mega doses right now. And, you can't train, you can't be squatting your 500 pounds and barbell rowing your 4 or 5 at home unless you're one of those bastards I hate that has a sick home gym. But other than that, take it all down a notch. It's a wait and see that announcement. Where's this going to go? Because right now we're not even sure the Olympias are going to be in September. Are they going to push it to October, November?
Wow.
Because, we're missing a huge chunk of the season. It's just gone. It's crazy.
So you can't do drugs. You can't have a heart attack. You can't have a DVT. You can't get a bad infection. Ron, so many guys get infections all the time. I treat infections like I drink water. So no, I do, because guys come to me. They trust me for that, and I'm an anabolic expert. They have to be treated. So, what happens is men get it intermuscular. They take steroids in the rear end, in the gluteal, in the leg, in the deltoid, and also in the lat. In the some extra classic places, the deltoid, the lateral leg, the lateral side of the anterior lateral leg, and in the gluteal region, different areas in the glute anterior. So, and men will classically, depending on what they're injecting, which is very interesting. We could talk for 6 hours, the probe where it's got the short acting, and then depending on the drugs. When guys inject, please listen to this, everyone. When they inject, is it after a day or 2 or 3 days? Is that burn and that pain, is that from the injection material, from the drug, or is it cellulitis now? It is. Let me tell you, I've been doing this for 15 years. I'm on the phone with guys. Is it red? Are you have fevers? Please, guys. I mean, you have to make your own decisions, because you're not going to be able to call up the teledoc. You just don't have access to it. And then when in doubt, depending on your allergies, we give you Keflex, Bactrim. I'm just telling. I don't like to give fluoroquinolones. Come on, now I'm giving you guys this. Doctors don't always know. Fluoroquinolones, Cipro, and Levaquin they'll knock out the infection. These are broad spectrum antibiotics. Okay, Levaquin, it's a monster, but it will tear. They're inherently very damaging to skeletal muscle tendons, and I've seen 150 tendon ruptures from men that have seen doctors in clinics, good doctors. They don't realize that they're giving a drug, or maybe they're giving a drug because you've blown through Keflex, amoxicillin, Bactrim, and now they have to give you a fluoroquinolone. Again, Ron, I'm giving the secrets, Ron.
I got to give a secret from my bro doctor here, as someone who's done thousands of shots over the years. I want to warn every guy out there, because we don't want you getting infections. You don't want that going septic and getting cellulitis. Out of all the shots I've done in my life, delts, a couple times tried the arms, never doing that. That was too painful. Did it like once. Anyway, the quad is the only 2 times in my life where it's gotten to the point where I was starting to develop cellulitis and had to get on antibiotic, was from injecting the quad. Stay away from your quads, guys. Palumbo has even said the same thing. I'll give him credit. He said, stay away from the quads. It's just a bad area.
I agree. But the lateral, the far lateral quad, for a lot of men. Ron, this is my job. You do it too, but I do it all day long professionally.
It's easy to reach. I understand.
But at the top of the quad, and it is interesting. Why would any site be more problematic? That part of the quad actually has no fat. The areas, cellulitis is actually an infection in the fat. So it is interesting. You'd think inherently it would be worse in the gluteal region, but to do gluteal injections, and you're going to agree, Palumbo, anyone's going to agree, it takes some mastery. Upper outer quadrant. There is some there's the ventral glute. I mean, this is doctors are, when I've talked to primary care doctors of patients. The patient has a good doctor, and doc, I got this good guy now, and he's seen the videos. Can you? And I talk to him, and these doctors are like, "Oh my God, Dr. O'Connor, what are they?" And they'll just be when they're decent and they realize that they're humble. They don't know anything about steroids, but they're a good doctor, and even endocrinology doctors, and they're very fascinated about all these different injections. And how do they know how to do it? Well, I said, well, cancer patients, and patients that have, women that have to take injections for fertility. He's like, well, that's a good point. So I said, they're motivated. And this is why the bro science, doctor, this is why you watch the videos. And this is a huge science where these men know so much about steroids, blows you away.
That's funny you say motivated. I saw an HBO special on heroin one time. And this guy was injecting his jugular vein, but I said, how could he do that? Then I thought, he loves the heroin. That's, he figured out. I don't mean to make light of it. Believe me, I know opioid abuse is a terrible thing. But I wanted to get to one last thing. You talked about this is a bad time to be in withdrawal. Obviously, I think what guys need to do, and I'm going to put some more just meathead advice out there, and you can comment or not. Guys, if you have a certain amount of test left, ration that stuff out. Take the smallest amount possible. If you don't know for sure when you're going to be, and most steroid users have that mentality anyway. It's they try to hoard enough so that they're not worried for months at a time. But maybe there is a situation now. I don't know. We still have U.S. mail. We still have, but the international shipping is
Let me
you
say
know
something. Let me say something. I'm going to do a video next week about something like that, something on this topic. So everyone initially called a couple of weeks ago. All my patients, hundreds of patients called, Doc, give me some extra testosterone. So listen to this. What's being hoarded is toilet paper and paper towels. I really still can't get my head around it. Food's not being hoarded. Thank God we have enough supply chain. Antibiotics are being hoarded. And we're not going to go into the malaria drugs and the rheumatologic drugs. I've got a lot of those calls, and those calls are going down. And the new med from China, we're not going to go into it. So, but no one, the good news is testosterone is not being hoarded.
Oh, good.
So the supply chain of the powder we have, and in America from Asia, we have a lot of it. I've talked to very large manufacturing grade pharmacies. HCG, I'm strong with it. I use tons of HCG for men to get them fertile, to get men off androgens, even for men that just like to have a little HCG for the testicles. And I've done videos on this, but it's man per man. So I have no problems with HCG. I have no problems with testosterone, cypionate, and nanthate in CVS, Rite Aid, Walmart, and Walgreens. We refilled 100. No problem. That's okay. You need to find a doctor that will prescribe it. Hopefully, a primary care doctor. If you say you're suffering and you can watch my videos and you haven't had an injection of testosterone for weeks, or maybe it's going to be weeks, and you tell him that you're going to go into anabolic and steroid-induced hypogonadism, it's a classic withdrawal. There's literature from me. There's Bashane at Harvard. There's Dr. Lipschultz at Baylor. He could look this up very quick, and it's unethical to not do anything about it. So that doctor you don't need to go see an endocrinologist, because you can't get in to see an endocrinologist. They're taking care of diabetes patients right now.
Oh, geez, yeah.
So you're not going to wait for 6 months to see an endocrinologist. Endocrinologists, very good doctors in diabetes and osteoporosis and pituitary and thyroid. Endocrinologists, apart from a few, know nothing about androgens inherently, and we know that. So they're not going to feel comfortable. Maybe they will. Hopefully in 10 years they will, or maybe 1 year after I start educating them with my series. And a lot of them are coming on board already. And that's why I'm very busy training doctors as testosteronologists. And I love this. But in the end, your good primary care doctor or a nurse practitioner that has a controlled drug license in whatever state you're in should give you some maintenance testosterone, Ron.
Yeah.
If you've been on steroids for years, why would you? So am I right or wrong, Ron? Come on.
You're right. But I got to tell you, probably about 15 years ago, maybe it wasn't that long ago, 10, 12 years ago, before I started seeing Morgenthaler, I got a referral for an endocrinologist. It was like a 5-minute appointment. It was a woman. And I don't think that would have mattered. I'm just saying it happened to be a female doctor, endocrinologist. And I said, I have these symptoms. I think, I used steroids for years, and I was trying to go off and go on. I knew I was aware of TRT, even though it wasn't that popular yet, but it was starting to, people knew it, but I had an awareness of it. And she just wasn't hearing it. I said, I'm tired. I said, these are classic symptoms. And can I get some blood work done? She's like, no, I'm really not comfortable. You're too young. I think I was 40. I might have been 30. I think I was 38 at the time. She goes, you're 38 years old. You don't need testosterone, exercise and eat right and blah, blah, blah. Say your prayers, take your Flintstone vitamins,
So Ron, this is what, but again, and that's why I'm humble and I'm strong, that there's millions of men. I don't know, Ron, 10 million, 20 million men have used steroids, including the guys on testosterone. That's another maybe 20 or 30 million. No, I don't know. No one's going to know these numbers directly. There's millions of them, and there's more and more and more because of SARMs. And half my day are regular guys like me and you that are 35 to 50 something that are on steroids and testosterone from anti-aging and everything else. And then I have young guys, Ron, 18, 19, 20, 22. They're coming off of SARMs and they're sucking wind. I feel so. This is the hardest thing in the world. Taking care of a guy who's in his 40s after being on steroids for years and years. I'm not saying I don't take that lightly. He gets blood work. I do a history and physical. We talk. We make sure, do you understand the side effects, how chronic it's going to be and what could happen. And then in the end, but compared to a 19, 20, 22-year-old man whose testosterone now is 200 or 300, and he has no sex drive, and he's in a pretty severe depression, and he's potentially maybe dangerous to himself, and he's in a very bad spiral, and maybe he has underlying depression. I see this now all day long.
Wow. That's sad. That's sad.
So we got to keep the young kids off steroids, guys, including SARMs. I'm going to do next week. I have so many media cues, and we're opening up another big media studio. I have so much going on. I'm kind of exhausted, but I want to get that out, Ron, to the young guys. Guys, doc, but what's the safe steroid? I did my research. Guys, there's no research. There's no safe. Don't do it. Don't do it. I guess back to the 90s or in the 1970s, train natural till you're in your mid-20s, right, Ron?
Yeah, late 20s in my case.
I'm just trying to be honest. And then don't ever do steroids. But give yourself at least into your late 20s and think about it over and over. And if you make that move, 1 Anavar cycle, SARMs are worse than steroids. I don't know what these SARMs are, Ron. They're horrible.
Well, yeah, I've tried them a couple times, not impressed. I wasn't impressed at all.
We have no data, but it's the guys that are coming in that are these young guys, they don't want to do steroids. So they're doing all these SARMs, and I'm going to have to do another video on it just from what I've learned, but we have no idea Ron, we don't even know what they are.
These are like the kids on gear that say, I don't want to stick a needle in me. I'm going to take 4 Anadrol a day. That's my plan.
I don't know. I'm trying to help, Ron. It's a little chaotic now, so I do apologize. I'm a little more.
Oh, don't apologize. I got to let you guys know, the doctor's been working all day. It is 9:15 at night. This guy's been on the go probably for a good 16 hours at this point, at least. Took the time to do this. So I thank you so much, Dr. Thomas.
Ron, thank you very much. We'll keep going, you guys. Everyone, be very careful. Don't do steroids ever. Think about what could happen if you do. If you do, don't do it during COVID-19.
Right. Yeah. Stay safe, everybody. Please check out the doctor's videos on his YouTube channel, Anabolic Doc. Visit the website that explains this new branch of men's medicine, testosteronology. You can find out exactly what it is. And, of course, get the book, America on Steroids, It's Time to Heal, on Amazon.com. Thomas, thank you so much. Please stay safe. Keep doing God's work like you're doing. We appreciate you and every other medical professional out there right now. You guys are the angels during this time of apocalyptic Armageddon, whatever we're going through.
Got to get through it.
All right, everybody. Thanks for watching. Ask the Anabolic Doc, and we'll see you next time.